Hi, welcome to Vance and Lee's lab.
For Oskies.
We have a special guest with us, Macy and Travis. Macy we're doing transfer techniques, and Macy will be reading for us.
Transfer techniques 1. Scenario is Ruby Cleary is an 82-year-old female recently admitted after fracturing her hip and undergoing right hip replacement surgery. A dressing change has just been completed. Assist Mrs. Cleary
This
into
is
a
Ruby
chair
Cleary.
using proper body mechanics and transfer techniques. Mrs. Cleary has been up in a chair on a few occasions and has tolerated it well. No other caregiver has been required. Document your care in the EHR.
Perfect. So let's start the performance assessment.
Okay,
Hold on.
So Travis is going to be our nurse, and you gotta make sure it's still recording. There we go. So Travis will be a nurse, and Lee will be our patient. All right. So verifies activity in order in the EHR.
Let me check the EHR. Okay,
That's good.
so it looks like they have okay mobility. What I need to do is I need to gather my supplies.
Okay. So gathers his supplies.
Oh, what do we have here? Let me just pull us right on in.
What supplies are you gathering?
I am gathering a gate belt
Only $9.99.
and a wheelchair
Perfect.
equipped with brakes.
Okay. Awesome. You want to make sure the brakes work. All right. So as he enters the patient's room, he will perform hand hygiene. All right. He is now in the patient's room, and he will identify the patient using 2 identifiers.
Hello, my name is Travis. Can I have your first and last name?
My name is Ruby something,
Cleary.
and my last name turns it down there. And my last name is, I don't know. My birthday is 100 years ago.
Awesome. Young star. Okay.
Introduce yourself and explains procedure.
So I'm Travis. What we're going to do is we're going to get you out of bed and we're going to sit you down in this chair right here, this wheelchair. And so, first off, that's pretty much introducing myself. I'm going to bring this bed to a height that's more workable.
All right. As he raises the height, the bed higher, he will assess for the following: muscle strength,
If he's getting her out of bed.
joint mobility, activity tolerance, level of comfort, cognitive status, and vital signs.
Okay, first off, I just want you to just squeeze my fingers. Now push and pull on me. Now I'm going to assess your feet. And if you could pull on my hands and then push. Perfect. Now pull on my hands. Oh, so it's your right leg that's kind of immobile.
Yes.
I see that you had a hip fracture on your right hip,
I had
correct?
it replaced.
Okay. So does it hurt your joints when I move your knee?
Yes.
Okay. We're going to need to move the knee a little bit.
Okay.
So how much pain can you tolerate? Could I tolerate if you brought it to a 90-degree angle?
I think so.
Okay, let's just move it right there. What about your left leg? Can that? Okay, let's just bring that up. Perfect. And are there any other joints that you are
No.
worried about?
Vital signs.
And now let's check your vital signs. First, I'm going to check your blood pressure.
It's for
Got
buzz. Yeah.
That's blood pressure. Let's take your pulse ox. And I'm going to check your pulse and respirations. And lastly, we're going to check your temperature. Boom. Okay, we're all set to go. Is there anything else do you know where we are right now?
BYU, Idaho.
Perfect. And do you know roughly what time of day it is?
Now 5 o'clock, dinner time.
Perfect. So neurological assessment is good. And
You want to assess the patient's specific risks for falling when transferred. I would ask him.
have you fallen recently?
No, I fell before the hit, but I've been okay so far.
Okay. So have you been able to get into the chair recently?
Yes.
Successfully? Okay. So a little-
Positions chair toward patient's stronger side.
and this left leg is the strongest side, so I'm putting it right here.
Alright. Places bed in low position, lower side rail, and turns patient to one side with knees flexed. Sometimes I get confused when it says knees flexed because
You're
when I
gonna
flex
lower
my
the
knees
bed.
like this.
Yeah, but it seems like it's right here.
You lower it and then the feet are
You probably want it lower.
Yeah, you want it all the
That's
way.
pretty
all the way down.
I usually put it at the height of the seat on the wheelchair. It's like they're gonna go from sitting there to
a little
sitting there.
higher.
Okay, perfect. That's fine.
Okay. So first off, we're gonna bring your knees to a like that 90-degree angle. Perfect. And now I'm gonna put the bed up in the high phallus position.
Raises head of bed to highest position.
I'm not as awesome as Vance.
You're good. You're a good patient.
I'm patient.
Perfect. And now if you can
Come
swing.
this way so you don't get my butt.
First off, we're gonna have you support your left arm and swing your leg over off the side here.
Okay.
So first sit up and support yourself with that left arm, and then move your legs just like that.
So get a firm base and you hold the patient's shoulders and support them up. There you go.
Perfect.
Okay. Applies transfer gate belt
So the
with
feet-
handles.
I would lower her
Yeah, the
because
feet should be on the ground.
I need to scoot back. That way we can get the whole shot. You guys deserve an Academy Award for this performance.
It's always awkward in the senior home. You're like, am I under your breast? You know, like sometimes it's like you don't know if you're on top of them.
They
or
literally don't care. Most people don't.
They don't. They're just like,
Now I'm locking the wheelchair.
Or they'll just readjust it.
oh yeah.
What are you gonna make sure is on her feet?
And I'm gonna make sure she has the right shoes, a non-slick. Here we go. I'm gonna put those on you right here.
It's like Cinderella.
They're the perfect
Fits.
fit.
Okay. So first off, when I'm gonna rock you 3 times.
Ah! It died.
I'm gonna